Have you ever stopped to think, does the kind of job you have really make a huge difference to your mental health? Or is it maybe simpler than that, like just having a job versus, well, not having one? Today, we're going to dig into exactly that. We've got a brand new study from Norway, hot off the press for 2025. They looked really closely at over 2,000 people seeking mental health treatment. So our mission is to see what this latest research tells us about work, unemployment, and our well-being.
Right. And in this area, researchers usually think about it in sort of two main ways. There's the occupational stress hypothesis. Basically, some jobs are just tougher, more stressful than others. And then there's the work enhancement hypothesis, which is the idea that just being employed is generally good for your mental health. This study helps us see which idea holds more water here.
Okay. And what do they find? What's the headline?
Well, the big surprise, maybe it was that it's a specific type of job someone had. It was actually less important for their mental health than simply whether they were employed or not.
Really, less important. So just having a job.
Exactly.
Yeah.
But here's where it gets really interesting. They found that different types of unemployment were clearly linked to worse mental health outcomes. It wasn't just one category.
Okay, tell me more about that. What different types?
So they looked at people receiving disability benefits and also those on something called work assessment allowance. That's a Norwegian benefit for people trying to get back to work after sickness. And these groups, they showed significantly higher use of psychotropic medicines for mental health conditions. They also reported more anxiety, more depression, and just generally lower functioning and worse health overall.
Wow.
Yeah, and the numbers really back this up. These groups were way overrepresented in the people seeking treatment compared to the general population in Norway. We're talking unemployed people were there at 3.44 times the rate you'd expect, and those on that work assessment allowance, 2.7 times.
That's quite a gap. So on the flip side, what about the people who were working? Was it all positive for them?
Generally, yes. The employed group reported, less use of those medications, better overall functioning, better health, pretty much what you'd expect from the work enhancement idea.
Okay.
But while the main story is about employment versus unemployment, there were still some differences between job types, though smaller.
Ah, okay. Like what?
Well, interestingly, managers actually showed higher levels of depression and worse work and social functioning, even after they adjusted for things like income.
Huh. Managers. You wouldn't necessarily expect that.
No. And conversely, people in jobs usually requiring a college degree, think engineers, health professionals, they tended to show better mental health. Less alcohol use, less depression, less anxiety, better functioning.
Right. And what about other groups? Did they mention others?
They did mention clerical workers. They were also overrepresented in the sample, about 2.5 times the general population rate. But their mental health profile wasn't consistently sort of better or worse compared to other employed groups. It was a bit mixed.
So the big picture still points back to just being employed as the major factor. Why do you think that is? Beyond the obvious, like paying the bills.
Well, work gives us so much more than just money, right? It gives us a daily structure, routine. It provides social interaction, which is vital, a sense of contributing, feeling valued, plus, opportunities for autonomy, maybe learning new things, status. It's a whole package.
That makes sense. It's like a structure for life in many ways.
Exactly. And that whole package seems to be quite protective for mental health.
But this brings up that tricky question, doesn't it? Cause and effect. Does unemployment cause poor mental health, or do people with poor mental health maybe struggle more to stay employed?
Yeah, that's the million-dollar question. And this study, because it's cross-sectional, like a snapshot in time, it can't definitively say which causes which. It shows a strong association at that moment.
But there's other research.
Yes. If you look at longitudinal studies, the ones that follow people over time, like a video, they generally suggest it's a two-way street, a reciprocal relationship. Poor mental health can make it harder to find or keep work, absolutely. But unemployment itself can also worsen mental health. There was a big Danish study, for instance, that found people with mental disorders lost, on average, an extra 10.5 years of working life.
10.5 years. That's huge, not just financially, but in terms of everything else work provides.
Precisely. Purpose, connection, growth.
So thinking about this study, what are the real-world implications? How should this change how we think about mental health support?
Well, it strongly suggests we need approaches that don't just focus on symptoms, but also actively focus on work, integrating mental health support with employment support, especially when you hear things like In Norway, that work assessment allowance sometimes being called a waiting list for disability pension.
Hmm,
And we also know that while people wait for mental health treatment, their sickness absence often goes up. It really highlights the need for early integrated intervention, doesn't it?
it really does. A work-focused approach seems crucial.
Absolutely. So the main takeaway here seems pretty clear. Having a job, any job almost, appears more strongly linked to better mental health than the specific kind of job you have, especially when you compare it to being unemployed or on long-term benefits.
So for you listening, maybe the question isn't just, is my job stressful? But how vital is work itself to my overall well-being? And if it is this vital, how can we support people better, maybe even ourselves, in a way that tackles mental health and work participation together? Here's a final thought to chew on. What if we started thinking about someone's work status as a key indicator of their mental health recovery, right alongside their symptoms or quality of life? Something to mull over until our next deep dive.